Oregon nurses are holding a conference today on an important topic facing the health industry: equitable outcomes for patients. The Oregon Nurses Association's Health Equity Conference in Portland today and Friday is focusing on the different outcomes from the health system for people of color. For instance, the maternal mortality rate for black women is 3 times the rate that it is for white women. Deborah Riddick with the Oregon Nurses Association says nurses interact with patients at every level of care.
If we had that amount of access to patients, to communities, to their families, that it would make sense that if there's a problem like health equity, that we would be the ideal folks to be able to plug the gap and be able to use some of our knowledge and our skills to address the problem.
During the pandemic, Oregonians of color have faced disproportionate health impacts. Hispanic Oregonians make up 13% of the state's population, but are nearly 30% of COVID-19 cases where the ethnicity is known, according to state data. Dee Watkins is an editor-at-large for Salon and a writer who is speaking at the Health Equity Conference. He says stigmas around healthcare especially are strong for black communities. Watkins says the words health professionals use are important.
Sometimes basic things like the way we use language when we talk about patients or when patients talk about these different institutions is the root of the problem, and it's what we need to fix if we want to be strong and we want to solve a lot of the problems that we have.
The Oregon Nurses Association has been working to promote health equity in the state through the legislature. Riddick says the union pushed for a bill this session that would have declared racism a public health crisis.
Unfortunately, there was not enough support for the bill that it ultimately was reduced down to simply a resolution. A lot of the things that required funding were pulled out, which was a great disappointment to many of the community members that worked throughout session around the bill.
Despite the bill not passing, Riddick says it was a good learning experience for pushing this type of policy. She also notes that the House bill's chief sponsor, Lake Oswego Democrat Andrea Salinas, is on a panel at the conference. For Oregon News Service, I'm Eric Tegedoff at publicnewsservice.org.